Well, the Ministry of Health and Social Services, together with the U.S. Agency for International Development, USAID, launched a community-based HIV testing in the health extension program at Engela in the Ohangwena region. The program is implemented with the support of the U.S. President's Emergency Plan for AIDS Relief, PEPFAR. USAID Country Representative Brian Fink now joins me with more on the details. Good morning, Mr. Fink, and welcome to GMN.
Good morning. Thank you for having me.
Maybe you can just give us a little bit of a context in terms of USAID working with PEPFAR and working specifically with health extension workers. What necessitates this kind of tripartite, multi-sectoral kind of coordination?
Sure. So U.S. Agency for International Development is just one of the many agencies here working on the President's Emergency Plan for AIDS Relief here in Namibia. And we decided to work with the Health Extension Program in 2012 when it was a pilot in the Opoa region, or in the Opoa district of the Kunene region. And we were working with the Ministry of Health and Social Services, along with the WHO, the World Health Organization, and UNICEF, to run a pilot to see what we could do to bring health services closer to the people. And to make those services available, such as health promotion, looking at primary health care, making sure people understand what they need to do in order to take care of themselves, even if they don't have access to clinics or hospitals in these far and remote communities in Namibia. Okay.
But I think, what we first need to clarify in terms of using health extension workers, because I think people have a very centralized idea around health,
right,
and that you go to health facilities. But how is this different in the fact that health extension workers go to the people? How does that change? Well, we're talking about access, but also in terms of how does it change the health demographic and that quotient in that regard? Why is this different and significant?
Right. So, as you know, in Namibia, there are many people that live far away from many city centers or from small towns, and so it's hard to get them to come to hospitals or to clinics for regular check-ins, if they're pregnant, to make sure that everything is going well with the pregnancy, if they're children, make sure they're having immunizations, that they're eating well, that they're not succumbing to childhood diseases. And so just based on Namibia's unique context, health extension workers are really the way forward in terms of making sure that everyone has access to the same basic health care package, whether they live in Windhoek, whether they live in Opoa, whether they live in Engela, and the health extension program is the way of going to go forward with it. And the Ministry of Health and Social Services really was a visionary in making this happen. Okay,
so that's obviously with any intervention there are challenges.
What
are some of the challenges that you guys face?
So as I said, there are great distances here in Namibia, and health extension workers usually have to travel up to 10 kilometers a day on foot with backpacks that can weigh up to 20, 30 kilograms, trying to take all the materials with them. And so that can present a lot of challenges. You've seen the roads up in the north, in several parts of the country. They're not paved. It's very difficult to get around. And so that's the major challenge. The other challenge is of how do we link these extension workers to clinics, making sure that they have some supervision, making sure that the people that the health extension workers are seeing, that they actually come to the clinic when it's a serious problem, when they need follow-up support.
Okay. Excuse me. Talk to us a little bit about in terms of what happens, or what kind of the mandate of these health extension workers? What services do they offer? We know, there's voluntary HIV testing that was taking place.
Right.
What are the various services that people can expect from health extension workers?
So first and foremost, the health extension workers coming to do health promotion or talk about health prevention, different topics. For children, as I was saying, it's making sure that they receive the immunizations that they're supposed to. The health extension worker won't necessarily do the immunizations, but say what immunizations need to happen and refer them to the appropriate clinic when needed. If it's a pregnant woman, making sure that she understands that there are certain visits that she should do during her pregnancy so that she's taken care of and the baby is healthy. If it's adolescents, making sure they understand about family planning and sex education so that they take care of themselves, that they protect themselves. For middle-aged and adults, making sure they understand things like hypertension, that they're taking care of, they're eating well, that they're exercising, that they understand the needs their needs. And then lastly, as you were saying, HIV/AIDS testing. Now our health extension workers, about 60 in the country so far, are able to do HIV/AIDS testing at home. What that means is that people that, if they don't feel comfortable going to a clinic to get an HIV/AIDS test, a health extension worker can come to their home and test them from there.
Okay. You spoke earlier about the pilot being in Nepal, now being in Engela. Is that where the programs are offered, or are the services offered anywhere else?
So right now, about 1,300, almost 1,400 health extension workers have been trained across the country and deployed in about 11 or 12 regions across the country. By April, hopefully all regions will receive health extension workers. I think our goal is to have about 4,000 health extension workers deployed across the country in April, and they will be able to cover all the rural areas of the country.
Okay. As a closing off question, obviously, one of the things that we've learned, whether it's health or education, is that there needs to be some form of shared responsibility. You know, we talk about whether it's education, we're saying quality education is a shared responsibility. Yes. Obviously, same goes for quality health. Must be a shared responsibility. Who are your primary stakeholders, and what sense of responsibility should they bring to the table when we're talking about, you know, health extension workers?
So this program has stakeholders across the entire country, whether it be at the community level, traditional level, whether it be with the health districts, the Ministry of Health, or NGOs in the field. But really what it comes down to are the people that are receiving these services and the health extension workers. And I've met some of these health extension workers, and the pride that they had in their eyes, the pride that they could deliver these services to people, to communities who didn't have access to them, and how they felt that they were really helping their community and their country to have better health. It was amazing. Okay.
Another interesting aspect that you're talking about is, you know, it almost seems like sometimes the health sector is very on the curative side of things, but this seems like there's a lot of effort being put into preventative health. Why is that key in the strategy that you guys have deployed in ensuring that family planning does take place, to ensuring that, you know, kids know how to protect themselves? Why is there a stronger focus on preventative health, and what precedents are you setting with this?
So as well known in the health field, it costs much less to prevent a disease than to treat it in the end. If people become infected with HIV/AIDS, that means that they're going to be on treatment for the rest of their life. That's drugs every day that they're going to have to take, that's testing that they're going to have to undergo. It becomes much more expensive. The same if people end up with diabetes or hypertension or childhood diseases they're going to have to deal with their entire life. So it's much more cost effective to prevent and to promote good health rather than have to treat health problems in the end.
Okay. So as a final question, how can we, as obviously Namibians, participate in strengthening this intervention?
So you can talk with your local communities, your local community members. You can also go to health clinics and see what needs to be done. First and foremost, if you see a health extension worker that needs a ride, that needs to get somewhere, help them out, pick them up, take them where they need to go, talk to them about what services they can provide, and see how you can make sure that the entire community receives these health services.
Okay. So, I should have asked this, but how do you identify a health extension worker?
So there isn't a uniform or anything like that for a health extension worker. They do have badges, so you can see that they are a health extension worker. Usually they have big backpacks where they carry around all of their materials, but talk to your community members, your community leaders, out in the different parts of the country, and talk to clinics and see how they can point you in that direction.
Mr. Fink, thank you very much for taking time out and joining us in GMN.
Thank you.
There you had the USAID country representative, that is Brian Fink, telling us, well, these health extension workers, and basically what they're trying to do is they're trying to increase the preventative side of ensuring that we'd have a healthy nation, that sometimes waiting until we need cures might not be the answer. But if you're out there in the regions and you see a health extension worker, extend your hand, open your car, assist them, give them some water, do anything that enables them in what they are doing. We'll be back with